640 WGST.
Welcome back. I'm Ben Chodor, and you've been listening to Health Tech Talk, broadcasting live from 640 WGST in the iHeartRadio studios and streaming worldwide on the iHeartRadio network. In this segment, I have Edward Shin, CEO of Quality Reviews, an incredible company that you're going to learn about over the next 30 minutes. Ed, welcome to the show. You are a serial entrepreneur. This is your newest venture. How are you?
Good. Thanks very much, Ben, for having me on the show. Really appreciate it.
I can't wait for my audience to learn a little bit about Rate My Hospital and Quality Reviews. But before we get into that, can you just tell us a little bit about your history? Because it's really fascinating. You're an MD. You've done a couple startups. You've sold a couple companies. You seem to do it all. It all seems to play in healthcare. But would love the audience to get a little background on you.
Sure. I'd be happy to. So I actually grew up thinking that I was going to be a doctor, and I went down that path and went to medical school in Philadelphia, came up to New York, my residency in internal medicine, and after all that, I really listened to my inner voice and decided to go the way of becoming an entrepreneur. And during the time of my residency in the late 90s, the internet was just taking off like crazy, and I really wanted to be a part of that. So when I finished my residency, I actually joined a small startup here in New York. They did streaming health videos, and really fell in love with the startup world and marrying health and technology. So long story short, for the last 15 or so years, have really been immersed in starting health IT startups and selling them to other companies. And this, as you mentioned, is my third venture, Quality Reviews, which is the name of the startup. We were founded a couple of years ago here in New York City, and we've developed our flagship product, which is called Rate My Hospital. And Rate My Hospital helps hospitals and physicians' offices collect and manage real-time patient feedback via mobile devices. And this is really an innovative approach to bringing what I like to call data transparency to the patient experience. Healthcare is oftentimes a laggard when it comes to embracing technology and technology-enabled services to help improve overall delivery of care. And this is a small but very notable step in terms of improving the patient experience in real time.
So, Ed, how do the patients get the information? So I understand the whole concept, and I know the company pretty well. But for my audience listening, is it the moment the patient leaves the hospital, when he's in the hospital? Is it an email? Is it a phone call? What basically happens, and where does that information go?
Sure. Well, we're in all settings of the hospital, both on the inpatient side and the outpatient side, and we can talk a bit about the outpatient first. So when a patient visits their doctor, as soon as they check out of the doctor's office, we, meaning Rate My Hospital / Quality Reviews, will text that patient a HIPAA-secure link to a patient satisfaction survey that the patient will take right on their smartphone. And we get all that information from the hospital. So it's all done in the background. There's no added emails or phone numbers to fill out. It's all information that we get by a secure link from the hospital. And it's all done by text message. Our research has shown that the text open rates are 5 to 10 times higher than those of email. So we really bypassed email and went directly to SMS text. And that certainly has been borne out in the experience that we've had over the last couple of years. And then the patient fills out that survey. It takes less than a minute. It's on a consumer-friendly 5-star scale that most consumers are familiar with, be it Yelp or TripAdvisor, et cetera. And that's really it. Now, the beauty of this is there's no app to download. So because it's all done via the web, there's no native app to download. It's all one click, done. And again, it takes much less than a minute for that patient to fill out their survey feedback.
But it's instant. So what I'm trying to say is, so if I'm a hospital CEO or I'm running a practice or I'm a physician who's ever getting the information, after I leave or if I'm inpatient and I get this survey and I take it, via my phone, I'm giving results instantly. So they're not waiting for a paper survey to come back weeks later or months later. I can actually do something as an institution to make a change in what we're doing almost instantly? Is that what I'm hearing?
That's exactly right. It's all real time. So let me share, excuse me, some feedback that we have with some of our clients. The median response time of the patient to fill out a survey is less than an hour. When you compare that to a paper-based response rate and response time, you're talking about weeks, if not months, before the hospital is getting that paper survey result back. So as you mentioned, because the patient is submitting their survey feedback in real time, i.e. less than an hour, the hospital leadership can respond to that feedback in real time. So, for example, patients are saying that the waiting area of the emergency department is filthy. The administrator can see that, dispatch housekeeping immediately, and then improve the experience for the next couple of hundred patients in the ensuing hours that follow. So this is really more than just a survey tool per se, but really a performance improvement tool so that hospitals can take the pulse, literally, of the patient experience and, based on what the patients are saying, make those improvements on the fly.
But I could also say then it's also a patient engagement tool. So I'm, as a patient, going to feel good about the institution because you're asking me for my opinion now when it actually happened. So is it both sides? I mean, do hospitals and do institutions just do it because they want to get this information, or are they doing it also because they're building that bridge to the patient?
Well, I think it's both. I think you really hit upon an interesting side effect. So I think the primary reason that hospitals will use our service is to take that pulse and become that real-time performance improvement driver. But a beneficial side effect, if I were to borrow a term from medicine, is that there is this ongoing patient engagement that really fortifies and strengthens the provider-patient relationship. Now, previous to this, oftentimes patients will get letters in the mail weeks to months after, oftentimes embedded in with a bill, and that certainly doesn't do that much to strengthen the patient experience and the patient bond. But by engaging the patient where they live, i.e. on their mobile devices, immediately after the episode of care, you as the hospital are telling that patient, I understand you were here. I'm very interested in your feedback because we really care about delivering the highest quality care to all of our patients. And I think that, to your point, it becomes a very beneficial and pleasant side effect of a tool that's being used to drive performance improvement.
And as the institution, as the hospital, can I control what questions are being asked? I mean, or is it just a set of questions that quality review says, here's what you have to do? How much control do I have as the institution?
The institution has complete control. I mean, it's a complete customizable tool. So unlike paper or a phone interview, because this is all done via software and very lightweight, the hospital can make changes to the survey questions moment by moment. And it's very easy to do so that if, for example, the hospital has a new initiative that they want to test and get feedback on, be it a patient experience initiative or a patient education initiative, they can change and alter the questions so that they can measure the patient response to this new initiative. Customizable. It's within the control of the administration. Now, we, Quality Reviews, have a lot of experience delivering these surveys, so we do advise our clients to have a set of benchmarking questions that are consistent across all of the different hospitals and all of the outpatient practices so that the hospital administrators can then compare apples to apples, so that if you're a health system and you've got 5 different hospitals, by asking the same questions, then you can start internally benchmarking the various institutions within your health system, which becomes a very effective tool to start measuring performance against each peer group.
And I know your company's on fire. You guys are doing amazing things out there in the marketplace. But how are the initial institutions that you engage with, how are they enjoying the feedback? Are they liking the information they're getting? Are they growing? Are the response rates going up? What's the response been from the customer?
Absolutely. So we've launched our first customer nearly 24 months ago, in New York, and it's just caught on like wildfire. This is a Mount Sinai Health System, a 7-hospital health system in New York City. And since we launched in one outpatient practice within the institution, and you fast forward to today, we are now embedded into the entire health system, including all 6 emergency departments, the inpatient setting, as well as slowly but surely going throughout the outpatient system. So the client, when they see the data turn on, when they see the patient submitting feedback, and literally the results are changing before their eyes on the dashboard, they get it.
And I need to interrupt you, and I want to come back to the dashboard and the business side. I need to cut to commercial break. I want to give a special thanks to 1-800 Public Relations for all their PR and media support, and to Stream BPG for all their production support in the studio. You're listening to Health Tech Talk, and with me is Ed Shin, CEO of Quality Reviews, and we'll be back after these words from our sponsors.
Facebook, a place where you can go to share your thoughts on stuff that matters to you and connect with a lot of other people. Gee, what a concept. Sounds a lot like talk radio, where you can tell us what's on your mind.
I believe the American dream is over with.
Your status.
I'm sure worried to death for my kids.
And make new friends.
I've never called a talk show before.
Talk radio, the original social media. Talk Radio 640 WGST.
Honey, 22 points. Darling, 31 points. Schnookum bear. Okay, that's not a real word. The most romantic words are also some of the highest scoring words on the new Words with Friends. Basically, while you're swooning over your honey bun, 26 points, you could be winning the game. Now, I'd say that's a great Valentine's Day. Download the new Words with Friends now on the App Store or Google Play. May the best friend win.
Hello all, I'm David Nicholas, host of Protecting Your Retirement right here on 640 AM WGST. We've got a new showtime starting Saturday at 10 a.m. and Sunday at 10 a.m. right here on 640 AM WGST. We hope to see you then.
Hello, everybody. Alan Thicke here. You know, our nation's tax laws change every year. The one constant is you have to pay them. Now, if you're one of those millions of Americans who owes back taxes, you know that the IRS is cracking down. They can garnish your paycheck, levy your bank accounts. Even your home or business could be up for grabs. But here's the good news. They're offering a new way out. It's called the Fresh Start Initiative, a government program for tax debt forgiveness. You could qualify for a settlement that's substantially less than before these changes. And nobody knows this program better than the experts at Optima Tax Relief. Their attorneys and enrolled agents will work to get you the best deal possible. Optima Tax Relief is accredited by the Better Business Bureau. Call them now for a free consultation.
Call 800-798-2477. 800-798-2477. 800-798-2477. Some restrictions apply. For complete details, please visit OptimaTaxRelief.com.
Tired of paying outrageous prices for Viagra? Well, we have great news for you. Now you can finally get Viagra at huge discounts. Healthy Man allows you to save up to $500 on Viagra. Why pay U.S. pharmacy prices of $15 per pill or more when you can get Viagra for less than $3 a pill? Call today and get 40 Viagra pills for only $99. This can cost as much as $600 at your local pharmacy. You can't afford not to call us. If you want Viagra at the lowest prices, never pay $15 a pill pharmacy prices again. Get Viagra for less than $3 a pill. Call 1-800-809-5302 and save up to $500 and get 40 pills for just $99. Healthy Man is fast, easy, and affordable. Operators are waiting at 1-800-809-5302 to take your call now. Call 1-800-809-5302. That's 1-800-809-5302. Again, 1-800-809-5302.
Men, it's that time of year again. Valentine's Day. This is our time to shine. Well, supposed to be at least. We want smiles and fireworks when she opens her gift, not game show fail music. There's one gift that never fails to impress, and that, my friends, is a box of giant, juicy, gourmet dipped strawberries from Sherry's Berries. Now, men, these aren't just any ordinary dipped berries. These strawberries are huge and freshly dipped in rich chocolatey awesomeness. And then they're covered in gourmet toppings like chocolate chips and chopped nuts. Nothing scores more points on Valentine's Day than a box of Sherry's Berries. Plus, right now, they're starting at $19.99. You're welcome.
Guys, there's still time to get your gourmet Sherry's berries this Valentine's Day, starting at $19.99. But hurry, this incredible deal ends this Friday. The only way to get this amazing deal is to go to berries.com. Click the microphone in the upper right corner and enter secret code 5000. That's berries.com. Secret code 5000.
In the last decade, more than 400,000 people died on America's roadways. Since 1969, the American Traffic Safety Services Association has been working toward the ultimate goal of zero deaths on America's roadways. Safer roads save lives. Learn more at atssa.com. A public service from the American Traffic Safety Services Association.
Talk Radio 640 WGST.
Welcome back. I'm Ben Chodor, and you've been listening to Health Tech Talk, broadcasting live from 640 WGST at the iHeartRadio studios and streaming worldwide on iHeartRadio. In this segment, I have Edward Shin, CEO of Quality Reviews. We've been talking about the patient experience when you leave an institution, and I instantly get ability to give you my opinion on my experience. The good, the bad, the ugly. And we were just talking about the data that's being collected, and we were just about to talk about the dashboard. So picture this. You're the CEO of a major hospital institution, whether you're at Emory in Atlanta or whether you're at Mount Sinai in New York or you're anywhere. And I could instantly, Ed, you're telling me, turn on my computer, log on to my secure account, and I can see responses coming in real time?
Yeah, absolutely. So the beauty of this dashboard is all web-based, and literally the administrators, the C-level executives can log on and see the patients submitting their survey feedback in real time. Literally, they can see the answers changing right before the eyes. Further to that, the leadership can actually sign up for real-time alerts. So if an administrator or a chief operating officer wants to know every single time a patient submits a 1-star feedback rating, they can sign up for a text or an email alert and can get these alerts as frequently or as infrequently as they want. So they don't have to sit in front of their computer and log on and hit refresh every 20 minutes. So that's the beauty of this tool, is you, as the hospital leadership, can take the pulse passively. So you can see the results that are coming in and filter it based on what you want to see, if it's only negative or if it's only positive or a smattering of both. And I think the real power of this dashboard is that the data are being aggregated, displayed in real time. There's no manual Excel spreadsheets to upload, no data entry. It's all being submitted by the patient directly to the hospital, cutting the middleman.
So besides the hospital being able to instantly know what's going on and fix it, can I reach back out to that individual patient? Can I, as the organization, can I not only fix the problem at the hospital, but actually touch that patient? Is there a two-way element to this?
Absolutely. So, you asked earlier, how are our clients using this? And they've really taken this dashboard and given some great feedback. And one of that is really the basis of what I call the patient relationship management platform, or PRM. And what we built into the dashboard is what you just mentioned. It's the ability to document the administrator reaching back out to the patient either by email or more likely by a phone call to address that patient's feedback in real time and say, hey, look, we got your feedback. We're listening to you. Tell me more. Tell us how we can improve. And oftentimes I'll see these annotations that our clients are putting in and saying, I called Mrs. Jones back. She was completely but pleasantly surprised that I called her because she thought that this feedback was going nowhere. And that immediately, just by that act alone, has improved the overall patient experience. So it becomes a really effective tool, much in the same way that Salesforce has revolutionized this world of CRM. We are beginning to do that with our survey dashboard, which really is now evolving into a patient relationship management tool.
So, Ed, people listening to the show, the hospitals and institutions and other people, how can they find you guys? Where do they go?
Well, the easiest place is to find us online at www.ratemyhospital.com, and all of our company information of Quality Reviews as well as our product, Rate My Hospital, is there. Secondly, I can always be emailed anytime. My email address is ed@q-reviews.com. and very simple to reach me. So by those two avenues, you can be reached. And if people happen to be in New York, if you feel the office, we're located in Tribeca, and our address is on our website as well.
So Ed, that's great. We have like 4 minutes left, and I want to talk business. All right. So this is a business talk show, and we have audience members that are young entrepreneurs, established businessmen, healthcare executives, and obviously patients. Where did the idea come from, and how hard is it to start a business?
Well, the idea was actually generated by my good friend and co-founder, Lenny Achan, who is senior-level, C-level executive at Mount Sinai Health System, and he's been germinating this idea within the four walls of his institution for the last 10 years. So when I had the fortune of meeting Lenny, I took this idea and said, we need to start a business around it, and I followed my instincts. So certainly, within the context of the Affordable Care Act, this makes complete sense. How hard is it to start a business? I think that you know as well as I do, it's brutally hard. I mean, for the entrepreneurs and small business owners listening, I think that they'd be nodding their heads in agreement that starting any business is very, very difficult. And the reason why I've done this a third time is because this idea makes complete sense. You know, despite my being a physician, I'm a patient first, and I'm a son of a patient, I'm a husband of a patient, and this really resonated with me as giving patients a voice. And we've all interacted with the healthcare system, and we've all had our frustrating moments. And an aha moment came off and said, this makes perfect sense. It's super easy. Everybody walks around with a smartphone, and everyone's got an opinion. What better way to utilize the ubiquity of mobile devices and help the patients, help their providers deliver better care? And so despite the brutally difficult nature of starting a business, I was compelled to do this one just because the idea was so needed and resonates with literally every human being on the planet.
The passion in your voice is amazing. And you not only have passion, you have dedication, but at the end of the day, you have a killer product. But most importantly, you have customers. And my advice to anyone starting a business, being an entrepreneur, don't just build it for the exit. Don't just build it on a cool idea. Know that you have an audience and have clients using the product is key. And I got to ask you, so we're all about healthcare, but this could be used in other areas too, right? Shouldn't I be able to walk out of a Starbucks and know what my experience is? Wouldn't every CEO of any retail organization or anyone who deals with the consumer want to have your product?
Absolutely. I mean, I think that you're absolutely right. So this, in many ways, we started this company and named it Quality Reviews because we want to be agnostic to industry. So be it quick service restaurants, hotels, auto rentals, any consumer interaction would benefit from this tool and have a real-time consumer satisfaction dashboard. I think the issue with places like Yelp and TripAdvisor, which is a ton of great data, is that the businesses themselves are often reacting to the data and kind of chasing their tail almost. By having this tool in place, you're having the voice of the customer directly so that you can make meaningful improvements without kind of the noise and the distractions that often are fraught with some of these public, review sites. So I totally would love to get this in the hands of hotels and restaurants in particular, and that is certainly our long-term vision and plan.
All right, so I got one more question left, and then I got to wrap up the show. The audience that's been using it, have they enjoyed the ability to get the survey? Because I did it, and I think it's amazing. What's the general response when someone gets a survey?
I think the general response is one of surprise, but pleasant surprise. And I'll share with you an anecdote. So our first customer was an outpatient cancer center. So these are sick, older patients, and oftentimes
Ed, we're gonna have to finish this anecdote on our next time. Sure. So we're gonna have to get you back on the show, or they're gonna kill me at iHeartRadio for not ending the show on time. I want to thank everyone for listening to Health Tech Talk on 640 WGST, iHeartRadio, being broadcast worldwide on the iHeartRadio network. I want to thank Stream VPG and 1-800 Public Relations, and we are out of here.